Bismillah ar-Rahman ar-Rahim. This is our third lecture for helminthes, which is about the blood flukes. The blood flukes means the trematodes which live in the bloodstream or in the blood vessels. These we call also the schistosomes, as we'll know later. Blood flukes or schistosomes include mainly three human parasite species, which are Schistosoma mansoni, Schistosoma japonica, and Schistosoma hematobium. Less important is Schistosoma intercalatum in Africa and Schistosoma mekongi in Cambodia in Far East. The adults inhabit blood vessels, but their eggs appear either in stool or in urine according to the species. Schistosomes are characterized by being dioecious, means they have separate sexes. The two sexes, male and female, are different in shapes, and also the females are longer and slender, while the males are flattened behind the ventral sucker but folded ventrally to form what we call gynecophoric canal. It looks like a boat، يعني هتبقى شكل الميل زي مركب بالظبط which carries the female inside and moves with the female everywhere. Eggs are spinate and not operculate like other trematodes. No rhedia in the larval stages inside the snail, but there is sporocyst, then daughter sporocyst, which produces cercaria all over its life. Cercariae are directly infective by skin penetration. كل دي characters different than other trematodes, but they are true trematodes because they have the same structures like tegument, like intestinal ceca, like the parenchyma doesn't have any other characteristic features of other helminths. So they have separate sexes, the eggs are spinate, no rhedia in the larval stage, and also the cercariae are directly infective by skin penetration of the host. Um, this is a picture of schistosoma with the male having the oral sucker. This is the ventral sucker, and this is the folded area or the gynecophoric canal. This is the anterior end of the female, and this is the posterior end of the female because the female is larger than the male. Concerning the life cycle, the females pass to the small venules. The females and males pass to the small venules where the females deposit their eggs, while the male blocks the small venule for the female to get easy and the blood flow doesn't pull it back towards the liver. The eggs penetrate outside the vessels and pass through the mucosa of the viscera where the venules are around them, and this is helped by the shape, this is helped by the sharp spines of the eggs and the enzyme secretions of the merothelium, which lyses the tissues, somewhat aiding in their penetration. If the eggs get in contact with fresh water when excreted, and the, the host, whatever it is, defecates or urinates in fresh water, then the eggs hatch and liberate the merothelium. The merothelium swims to reach the appropriate snail host, where it grows into sporocyst 1, sporocyst 2, which liberates the cercari, no radius stage, as we said before. This is a diagram for the life cycle of the three main species of Schistosoma. A, for Schistosoma japonicum, we can see here that it affects the small intestine, the lower ileum, and the ascending and transverse colon. Here we can see this is the area for Schistosoma japonicum. Schistosoma mansoni, B, affects the lower part of the large intestine, which is the descending and rectosigmoid colon, while Schistosoma hematobium affecting the urinary bladder. We can see that the eggs pass in water with a fully mature merothelium. The merothelium escapes in water to go to the appropriate snail. This is the snail host for Schistosoma mansoni, which is Biofilaria. This is the snail host for Schistosoma hematobium, which is the Bulinus species. This is the snail intermediate host for Schistosoma japonicum, which is called Oncomilania. The sporocyst forms inside the snail, and it gives cercari, which are released by the snail into the water and free swimming till they penetrate the skin of human. Inside the skin, they lose their tails and become schistosomule, as they are called. These schistosomuli pass with circulation to reach the liver and grow and mature in the liver sinusoids into adults. Then they pass to the portal circulation and they come to their final habitat to deposit eggs. This is the life cycle of schistosomes. In general, it doesn't differ anywhere, even in animals. Infection occurs when the cercari directly penetrate human skin when he gets in contact with water. Sometimes it is called an occupational disease because schistosomiasis occurs to the people who work in water, like farmers, like fishermen, everyone who gets in contact with freshwater canals. The penetrating cercari lose their tail outside and undergo metabolic changes to become immature fluke, which is called schistosomule. Schistosomuli pass into the blood venules from the skin to the systemic circulation, pass through the lungs, and then reach the liver sinusoids to develop into adults. After 2 weeks, they migrate against the portal blood flow to their final habitat, wherever it is, the ascending colon, descending colon, or the urinary bladder. Types of blood flukes. We'll have an idea about the species of blood flukes which infect men, the three main species. Schistosoma mansoni, the first. It is present in many countries. The natural reservoirs are monkeys and rodents, so it is easily reared in laboratories inside mice or rats. The snail host of Schistosoma mansoni is Biomphilaria species. Adults live in the inferior mesenteric vein, which is draining from the descending colon and rectosigmoid colon. The adult males are about 1 centimeter in diameter with 6 to 9 testes. The females are 1.5 centimeter with the ovary situated in the anterior third of the body. This is characteristic for Schistosoma mansoni. The eggs are passed in stools. They are about 150 by 70 micromillimeter and have lateral spine. This is a picture of adult male and female Schistosoma mansoni, and this is a picture of the egg with the lateral spine here. Here is the situation of the ovary, and we can see that this part is pale in color and this rest of the body is dark in color because of the presence of vitelline glands as well as the united intestinal ceca which unite behind the ovary. Concerning Schistosoma japonicum, which is present in the Far East, but not in Japan. Japan has got rid of Schistosoma japonicum for many years. It is called Oriental blood fluke. Reservoirs are all mammals which drink from water canals. The snail is Oncomelania. The mammals, the differentiation of reservoir hosts, which are many reservoir hosts, and also the Oncomelania snail, which can live in mud even with no water around. These two factors help in they are the cause of the difficult control of Schistosoma japonicum infection. Its habitat is the superior mesenteric vein, which drains from the lower ileum, also from the ascending and transverse colon. Males about 2 centimeter with 6 to 8 testes. Females are 2.5 centimeter long with the ovary in the mid-body region. Eggs are small, rounded or oval, with minute lateral knob measuring about 70 by 55 micrometer, means that they are half the size of Schistosoma mansoni eggs. These are the eggs of Schistosoma japonicum with the small little knob at one side. These are the adults of Schistosoma japonicum, with the testes here are clearly apparent, making one row, and here in the female, this is the ovary. It is in the mid-body region, so the anterior part of the worm is very apparent. Also, the posterior part with the union of intestinal ceca is dark in color. Schistosoma hematobium, or urinary schistosomiasis, is present in the Nile Valley, in Africa, Middle East, India, and also in Cyprus, Cyprus يعني, and Portugal. The snail host is Bulinus species. Its habitat is the vesical plexus, which is the draining venules of urinary bladder and lower ureter. The males are about 1.5 centimeter smaller than Soma japonica, with 4 to 6 testes. Females are 2 centimeter long, with the ovary situated in the posterior half of the body. The eggs escape in urine, and they are 150 by 70 micromillimeter with terminal. This is the egg of Schistosoma hematobium with the terminal spine here. Here are some characteristic features which show that the miracidium is alive inside the egg. One of them is these flame cells. These flame cells are, when we look at them under the microscope, they seem movable. Also, here are the penetration glands of the miracidium in the anterior end, and these features with the flame cells show us that this transparent egg is alive and the miracidium is ready to hatch when it reaches water. This is very important because sometimes we must know that if it is an old infection and the eggs shedded in urine are dead or alive, to give treatment. Here is the picture of the adult male and female Schistosoma hematobium. We can see here, this is the anterior end of female. This is the ovary, and this is the posterior part of the female. The anterior end is very long, as we see, because the ovary is situated more posterior than that of Schistosoma japonicum and Schistosoma mansoni. Concerning Schistosoma mekongi, it is present only in Cambodia. It is similar to Schistosoma japonicum in morphology and in having many reservoir hosts, but it has a different snail host. The eggs are like those of Schistosoma japonicum, but somewhat smaller than Schistosoma japonicum. Schistosoma intercalatum is an African type of schistosomes present in Western and Central Africa below the equator. It is an intestinal schistosome with terminal spined eggs like Schistosoma hematobium. يعني هي intestinal زي الشيستوسوما مانسوناي، بس الايجز بتاعتها are terminal spine. The eggs differ from those of Schistosoma hematobium in having Ziehl-Neelsen positive shell. This is the differentiation between Schistosoma hematobium and Schistosoma intercalatum, that we can stain the eggs with Ziehl-Neelsen and we find that they are acid fast. Immunology and pathogenesis of schistosomiasis. In early stages of infection, during invasion, the schistosomules evoke allergic reaction. It is better seen or best seen if there is previous infection with schistosoma. The schistosomules and adult worms produce antigens similar to the host then to evade host immunity. But during penetration, we call it also circarial antigens. These antigens can produce allergic reaction in the skin, as we'll see later. The eggs have their own soluble egg antigens. They are two types and they induce immune reaction. This immune reaction is the responsible for the main pathology of schistosomiasis inside the human body. In early infection, granuloma formation around the eggs in the intestine or bladder can cause irritation. Then, when fibrosis occurs from granuloma, it hinders egg deposition, so the eggs are swept back to the portal circulation or entangled in the mucosa. When they are entangled in the mucosa, they, by the muscle movement of the viscous, which is either the urinary bladder or the large intestinal tract, we can see that the movement, the intestinal motility or the bladder motility can push the entangled eggs to form groups with the fibrous tissue around. They can push it to the lumen of the viscous, so they form what we call bilharzial polypi. Also, when the eggs are swept back to the portal circulation, they are deposited in the liver, and we'll see what they form. In the liver, the eggs can be lodged in the portal capillaries with fibrosis around them. There is, so we call the pipe stem or Seamer's fibrosis or bilharzial cirrhosis, as it was called. Seamer's fibrosis induces portal hypertension with huge splenomegaly, then ascites, and opening of collaterals between portal and systemic circulations like esophageal varices or piles or whatever it occurs. Opening the collaterals carries the eggs coming from portal vessels to the systemic circulation to form egg emboli. We also will see what does the emboli cause. This is an egg of Schistosoma mansoni with lateral spine and with mononuclear cells around here and here. These are mononuclear cells around the egg, which is the inflammatory reaction around the egg, inducing fibrosis later. Here is also another egg of Schistosoma japonicum. Here, with pale area around due to granuloma formation around the egg. This is the liver tissue as we see. The entangled eggs in the mucosa induce formation of granulomas, intense inflammatory reaction with fibrosis and patchy ulceration inside the viscera سواء كانت اليورينري bladder ولا الكولون. Polyps form due to granulomas around the eggs collections in the submucosa. This fibrosis looks pale when we do endoscopy, so it is called sandy patches because it looks like whitish or yellowish areas inside the pink mucosa. This is a picture of an egg inside the granuloma, which is pushed towards the lumen here, and this is finally will be a polyp. This is another egg inside the mucosa of the colon. In the urinary bladder, there is mucosal fibrosis, papillomata or polypi, and areas of fibrosis. If fibrosis reaches the ureteric openings, there is closure of these or stenosis of these openings, and there is back pressure to the kidneys from the collecting urine. In males with severe infections, involvement of male genital system occurs. In females with Schistosoma hematobium and Schistosoma mansoni, placenta may be involved with resulting stillbirth. Neurologic affection is mostly with Schistosoma japonicum because the eggs are ovoid and more readily dislodged from the mucosa and pass back to the liver with circulation. The eggs are produced in large numbers. Also, um, also, the collaterals between systemic and portal circulation open earlier because liver fibrosis occurs very early during the course of disease. Both adult worms and eggs of Schistosoma japonicum can cause focal lesions in the central nervous system. Spinal cord is involved in Schistosoma mansoni with transverse myelitis and sometimes also with Schistosoma hematobium. There is association also between the chronic salmonellosis and all species of schistosoma.